Okay. All right. Good evening, everyone. Thank you so much for joining me this evening. Starting on the dot here at 6 p.m. My name is Jacob Meyer. I'm the psychotherapist and staff that works at Integrated Health Systems in congruence with the rest of the team. Just thank you again for joining me this evening. Go ahead and look at the attendee list here. So we're starting it at 6 right now. Typically, I go for about 45 minutes. If you need to excuse yourself at any time, if you need to step away, that's totally fine. I try to keep it to 45 minutes. I usually say I try to keep it to 30 minutes, but I usually end up going about 45. So we'll see where that takes us today. And sort of what we're going to be getting into today, the point of the talk and the webinar as well, is what you need to know as a patient about EMDR. And that is just a really big buzzword. That and CBT are the two things I hear the most in terms of patients coming in with a little bit of research, but oftentimes not really understanding how that plays out in sessions, and not really understanding in terms of what they're really looking for in a therapeutic relationship and the therapeutic process in general. So I'd just like to talk about EMDR today, talk about a little bit about why traumatic memories occur, why trauma occurs through a more of a polyvagal perspective, something that is near and dear to my work. It is simply on the cutting edge. It's a fantastic orientation to have, to really be able to help people understand what's happening within their body, but also to understand things like, what state is my nervous system in right now? How can I shift that state? And EMDR is just such a wonderful complement to that in its understanding as well, because if we can understand a little bit more of why trauma occurs, we can understand a little bit more of, why something like EMDR works as well. So that's something we're going to be focused on today. There's a lot to be talked about. I can be a little associative and tangential with my speaking, so I'm going to try to keep it sort of reined in here. Again, if you all have any questions to ask or anything, I just ask you, just throw it up in the attendee chat. As you can see as well in the attendee chat, you can go ahead and click for a free 30-minute consultation, scheduling in the next week. If you want to call in for scheduling as well with Lindsay or Sandy, just call that main number. It's going to be included at the end as well, or you can always Google us at integratedhealthsystemsdenver.com. And with that, we'll get started here. And so first, a little bit about me. And, if you've been to these before, I always sort of introduce myself, a little bit of my background, and what I'm about, what I'm doing at Integrated Health Systems, and sort of what you can expect as a patient walking in the door there, just so it's a little bit more familiar to you. And again, I forgot if I just noted, if you have a question, go ahead and throw it in the attendee chat. I'm going to probably answer it at the end of a slide, just so I can keep everything sort of flowing on my end, so I don't get sort of broken up in it. And I'll do my best to answer the question, or just to offer some thoughts on that, if I'm not able to answer it. So, but back to sort of about me. My name is Jacob Meyer. I'm the sort of resident psychotherapist at Integrated Health Systems. I work in congruence with the overall team approach there with Dr. Perry and Dr. Stedman. In my main role there is working with the patient's sort of emotional profile with them walking through the door, and its relationship with why they are presenting to the clinic. We have all sorts of presentations that happen there, including chronic illnesses, traumatic brain injuries, autoimmune disorders, unknown diagnoses, diagnoses that people they don't feel like they're being treated properly, more of in the Western model. And just people really looking for a comprehensive approach that is sort of looking at the whole person, and coming from a more brain-based, body-based perspective. And I'm sort of added into that as well, in terms of, hey, how are our emotions doing? How do our emotions affect the stress that's happening, the very physiology changes that happen with stress within our body, and what are the origins of that, and is that relevant to your overall treatment goals here. And so I'm here to come from that emotional perspective in congruence with the rest of the team, and just to sort of really provide an integrated approach. And I sort of skipped ahead to my role at IHS, and my background, how I sort of cut my teeth in this field, is working in addiction and trauma. I was able to work for several years up in Westminster, Colorado, getting my start working in a methadone treatment center, in an outpatient setting. So working with a real big caseload of people there, and really sort of learning about addiction firsthand, learning about opiate addiction, benzodiazepines, alcohol, amphetamines, sort of you name it. I've seen it and heard it all in that setting. Tons of trauma was present with that population. Just a lot of struggles that people were going through, and it really gave me a great sort of basis to see, and it's really helped my work being able to sort of find my grounding at integrated health systems in terms of how does stress affect a person, their emotional system, their environment. How does that sort of flow through? And I would see people sort of over and over again sort of go through this process in their recovery, helping people sort of break themselves from addictive loops, helping people to get off of methadone as well, and really seeing all the challenges that come their way and all the struggle that comes with this really gave me a great basis to work from. And my work at integrated health systems is definitely informed by that time, obviously in a very, very different setting. But I've really been able to sort of brush up and refine my approach in terms of, what is our nervous system and our impact on our mental health? How do states inform us, states of our nervous system, and how it really affects our cognitions, our emotions, our choices, our relationships, whether that brings us closer or more distant, whether we feel trapped or we feel connected, whether we feel sort of way too up high and way too overactivated and stuck in the classic fight and flight mode in that area. So really have been able to develop a lot more of a comprehensive and brain-based approach, all evidence-based approaches that I use, very heavy in the relational setting, as well as centering mindfulness meditation into my practice, and also sort of working from a general psychodynamic approach. And what you need to understand about that is, as a psychodynamically based therapist, I am looking for how is the past showing up in the present, and how can we follow its present presentation to the past to help us process that, so it's not affecting the present in our life anymore. And so more about that coming up, but just a little bit about me, and my work, and sort of my basis, and how it's sort of formulated my clinical lens as well. Definitely a lot in addiction, a lot in trauma, a lot with relational and family work. Very, very, a very good base I was able to set there, and sort of just building off that and continuing to refine and integrated health systems. And so now sort of getting on into what you need to know about EMDR. And so what is EMDR? That's a big question. I mean, a lot of people, even I still struggle with the pronunciation of it, and it's eye movement desensitization and reprocessing therapy. And so, of course, some basics on trauma will need to be covered, I think, to give you all some context in understanding why EMDR works. And so I'd like to give you sort of an example, just to jump off here, in sort of, if we can imagine our emotional system within our bodies, how stress flows through us. It's sort of like almost a plumbing system in that way. And so I want you to understand people, yourself, loved ones, people struggling with either traumatic experiences, smaller traumas, adverse life experiences, chronic stress. This can all affect us over time, and it's contingent on the frequency and sort of the intensity of our exposure to these stressors. And so how I want people to understand is sort of through our own personal plumbing. And if we can understand sort of traumatic experiences, adverse life events, chronic stressors that really start to affect us as sort of these pipes that are not correctly set. If we can all imagine the plumbing within our home, that's something you want to work very well. It's not something you want to overload in that way. You never want a pipe to burst there. And so if we could think about someone who struggles with dysfunction, traumatic experiences, etc., we could think of it as sort of incorrectly set pipes. The system is functional, but it is operating at a dysfunctional level. Dysfunctional, so it still works, but it does not work at the proper amount to be more adequate to deal with sort of higher flows of stress that come through it. So if you can imagine, a lot of people have probably been to a home where the septic system, the pipes can handle only so much. And if you go over that, the system really struggles. Okay. And so if we have a dysfunctional system, it can keep moving. We just have to understand that it's very affected by the amount of stress that's coming through it, the amount of flow that's coming through it. But if we add a high level of flow to a dysfunctional system, you are surely going to get a system that's very overwhelmed. And so that's typically how we can start to understand people who have experienced trauma, people who have experienced dysfunctional sort of relational attachments in their youth, classically people's mother and father, also siblings and friends included in that, an extended family. And so we can understand that people who are having these experiences, typically negative experiences, typically experiences that they become very afraid, they feel isolated, they feel alone, they feel an incredible amount of shame. They're getting sort of these imprints and this sort of frequency and these primers into, this is how I understand the world. We understand the world not through us looking at the world. I mean, Dr. Perry and Dr. Mann would probably argue with me with that a lot, and they'd probably be pretty right. But from my perspective, we sort of see the world through our relationships, through our relational environment, as I call it. And if our relational environment, even though if it's safe in terms of we know it's safe, we know we're going to go to bed, we know we're going to wake up, we know that our house is relatively secure. But if we don't feel safe in that environment, that can have an incredible effect on us in a long-term setting and how we deal with stress, how we view the world itself, and sort of how we understand ourselves and parts of our identity that can start to emerge because we're growing up in an environment that's unstable. Maybe we're suffering traumas, we're suffering losses, we're suffering from inconsistent care. It can be a lot of things that sort of build these traumatic experiences, these sort of one-off events into something we call, and it starts to connect together into sort of what we call a complex as well. And so there are differences between a complex and a trauma, but they can be one and the same. It's sort of a more refined thing to understand that I don't think I'm going to be able to get fully into this evening. And so if we can sort of understand some of these basics on trauma, the issues with memory storage that happen, we can really understand EMDR and why it works a little bit more. And EMDR, again, eye movement, desensitization, and reprocessing therapy, is really an evidence-based way to use what we call bilateral stimulation. So that can be done with eye movements back and forth. That can be done with tapping. That can be done with tapping on our thighs. That can be done with different tones. In using bilateral stimulation in congruence with a very relevant and investigated image, emotion, and negative cognition that sort of directly targets with those three entry points, that image, that emotion, that negative cognition, into the very heart of that distressing memory, that distressing sort of complex, this thing that's developed over time due to a lot of frequency and intensity. And it sort of creates a lot of rapid therapeutic effects. We're able to clear those channels out in a very direct, very structured, very evidence-based way to have the person find a lot of relief in a psychological and emotional sense. We're sort of, we always say at integrated health systems that our body is the hardware and our emotions are the software. And through training in EMDR, starting to work with it, having some experience with that, I'm really seeing people's emotional profiles much, much more so as hardware in itself. And that's something in the therapeutic process we learn to sort of change and to sort of cut through is how are we going to change the literal pathways in our minds and internalize these different structures of our identity so we can live more effectively. So when that heavy load comes through the pipes, when a lot of stress is coming at us, when we're transitioning into a new part of life, when we experience a loss, that we're not completely overwhelmed, that we're able to deal with the stress, we're able to move it through us, so we're not overwhelmed and sort of stuck in that stress. And so it's all the EMDR is one of the biggest evidence-based therapies that's out there for treating trauma. It's endorsed uh, by veterans associations, by the VA, by the Veterans Hospital. This is something that's being used to a very effective manner within the therapeutic setting, especially within the past 10, 15 years. It's really coming into popularity because it does produce rapid treatment effects. But I want to remind everyone today, this is something that's very, very powerful. And so one of my biggest jobs as a therapist, just like a doctor's job as well, is to help people understand, okay, this is the treatment that we're using. This is why it works. But also that, hey, general therapy is stressful. A good therapeutic session is going to bring you into a level of stress and discomfort that's useful for you, just like a good workout. And so if we need to understand EMDR is maybe a little bit of an extra level of stress there, and it's different for everyone. But what we do know is that it's very experiential. We are coming into a lot of contact with these thoughts and feelings that a lot of people have to avoid. To be able to survive, to be able to move through, they need to push these things away so they can focus on the present, so they're not in a level of distress that's making them so dysfunctional that they're not able to meet daily requirements. And so I want people to understand that fast is not easy, and there's a lot of movement through distressing emotions and traumatic memories that can be very destabilizing for the patient to experience. And so I'm very, very frank about not only therapy, just in general with me, is going to be a stressful thing. But EMDR, we're heading into sort of a more stressful emotional territory here. And we need to be able to work with that stress of EMDR and find the balance with it. We need to be able to understand that EMDR is something that is housed very specifically within safety, within the therapeutic alliance, the therapeutic connection. The patient needs to be able to be very honest. They need to be able to feel like, hey, I can say something that's really hard, and Jake here is not going to judge me for it. It's going to be okay. He's going to understand. And the person needs to have enough trust with me to understand that, hey, I can say that this is too much right now. A lot of people are very gung-ho. They want to jump right into something like this. And I'm sort of like, whoa, whoa, whoa. We need to slow it down and make sure you're okay, not only in terms of feeling safe with me, and not just thinking you're safe, but really feeling that safety with me, but also that you're able to handle it in the stress outside of sessions every week, and you're able to properly ground yourself if processing in between sessions is just really tough, or maybe something unexpected happens. So this is sort of an overview of what we're going to be talking about today. And so we'll move into a little bit more of some of the basics on trauma and adverse life experience from a polyvagal perspective. And how I want to sort of start talking about this. Oh, I need to move the slide up here. There we go. And so we're working from a polyvagal perspective here. And the polyvagal perspective is really sort of where a lot of my world and like Dr. Stedman and Dr. Perry's world meet and really, really intermesh into each other, along with the changing structures of the brain as well that happen with things like mindfulness meditation or breath work, that happen with experiencing therapy and really getting to that level of trust with the therapist. We're really able to shift pathways in the brain. We're really able to upregulate our frontal lobe here. We're able to downregulate that midbrain, and we're able to understand the world through experiencing it, through embodying that with the therapist, that, hey, I'm okay here. I can go to a difficult place, and I can now reasonably expect and internalize that this is an okay stimulus for me. And so this is sort of where our worlds really interlock and mesh, and where I'm really able to help patients in terms of our overall perspective as a clinic. And so understanding the polyvagal perspective is really understanding what that vagus nerve is and how our nervous system has evolved over time, all the way back from the reptilian brain to the base of our brain to the basic mammal part of our brain into more of the social and human part of our brain that's only sort of in more advanced animals, but especially pronounced in human beings. And so what I want people to understand first is that vagus nerve. The vagus nerve is in the name, polyvagal. And so we can understand the vagus nerve as something that it starts in our brainstem here. It runs down to our heart. It connects to our gut as well. And it also runs up from our heart to our face muscles as well. So when this nerve activates, it really affects a lot of our body. And depending on the state that we are in, we are implicitly communicating what kind of state we are in. Okay. And so what I want people to understand, we can look at this sort of infographic on the right here. Okay, the social engagement system is very, very associated with the parasympathetic nervous system. That guy there, green light. We're happy, we're engaged. His arms are even open. He has a smile on his face, and he looks like he's ready to engage within the world. He looks like a happy fellow there. That's where we want to be housed and dominant in our iteration of culture now. And so if we get stimulus within our environment that indicates that we are under threat, what we will do is shift into that fight and flight mode. We're going to start embodying more aggressive tones. We're starting to get cut off from our frontal lobe here. Our eyes start to focus and narrow in. Our brow might sort of pitch forward here to let people know, like, hey, I don't feel safe. I'm starting to protect my neck here. We're going to start to close in on our shoulders here and sort of start signaling to others in an implicit way that I'm under threat. I'm not okay. I don't feel safe. And if that persists, or if we feel especially under threat, and if that sympathetic engagement that's associated with fight and flight, if that sympathetic engagement in our nervous system, if our fight and flight system is not getting us out of this danger, or if the danger is so great that our life is being threatened in an imminent way, what happens with many people is that now we have this shutdown that happens. The guy on the bottom there, he has a very depressed looking face. Oftentimes the shoulders start to slump. Our head starts to turn towards the ground. We're sort of shutting down and submitting. We're freezing in this moment. And this is our sort of our final layer of protection. This is where a lot of depression and disassociation typically happens. This is typically where people go when they experience what we call a big T trauma. You know, they're very threatened in their life, dealing with combat, dealing with a sexual assault, dealing with being overwhelmed physically in a very violent attack. We can start to shut down and sort of lose control of our body. And this is very, very confusing for people, but these have very, very direct, measurable, sort of evolutionary basis for their development. So we can sort of track these states. That shutdown state on the right is sort of is tied into our dorsal vagal nerve. And this dorsal vagal nerve has been here and is present in reptilian animals. And so, like I said, you know, sort of starting in on this triune brain perspective and sort of shifting around here a little bit, but sort of in beginning to understand our nervous system, now we can understand its development and within our brain as well in evolution. And so what animals still have, and reptiles and very primitive animals, when they're under threat, they shut down, they freeze. We've all sort of seen that freeze that happens sort of in a hilarious fashion with there's a species of sheep or goats that farmers can scare and they fall over. And then that's a pretty direct dorsal vagal activation, but it's a very primitive part of our brain that's very, very old, and where the brain had evolved to a point where only immobilization and that automatic response to the environment was available. And as creatures and especially mammals, started to get more advanced, we started to develop our sympathetic nervous system in our sort of midbrain here. That's present in most animals that we see, and especially solitary animals. We have this very pronounced fight and flight activation. Our adrenals start firing, cortisol is being dumped into our body. We are here in this moment ready to fight for our life, or we are ready to run away. This is a highly dangerous situation that our body is perceiving. And this is something that, just like the shutdown, is useful depending on the context. And the thing that I say to so many patients, parents, and people that I consult with is that if you're on the front range here and if a mountain lion happens to jump out at you, I really want that fight and flight system to start firing. I really want you to move away from that animal. I want you to start communicating with your body and mind to that animal that, hey, I know you're here, you're a threat to me, and I'm ready to do something about this. Extremely useful in the short term there. And so, but it's just context dependent on where that system fires and for how long it fires. But to not get too far off track to talk about that fight and flight system, we can move finally to the social engagement system, that frontal lobe development. And so the social engagement system, our parasympathetic system, has been developed to be able to downregulate the fight and flight system so we can be in close proximity with others. So we can downregulate that adrenaline, that cortisol, so we can have pro-social bonds, so we can work together and find aspects of safety. And so that's been very, very beneficial for human beings, to be able to work in close quarters, to be able to nurture young, to have long developmentary periods, and to really sort of put everything into our brains from an evolutionary perspective. And so very, very useful for us. But we all know of situations where that fight and flight activation for us or someone else might have been disruptive. We might have been feeling those sweaty palms, that tightness entering our body. We could feel from someone else that, hey, they're not sending me signals of safety here. They might be looking through their brow. They might be tighter and more articulated in their teeth as they're talking. They might be signaling to you without even knowing it that they're perceiving you as a threat. And so when our body starts picking up on these states, this is a concept called neuroception that Dr. Stephen Porges, who is the founder of polyvagal theory, sort of came up with. And this is our body's ability to perceive independently of our conscious awareness that, hey, this person is safe. This person's in their parasympathetic system. Hey, that calms me down too. Or, hey, this person right here is signaling danger and threat to me. Or, hey, something's going on with this person. They seem really not okay. They seem really shut down here. And so this is all happening in sequence within environments. And we've all had that moment. We've all had that feeling where something typically in our stomach here or typically in our shoulders will start signaling us that, hey, something's not right. Something's not okay. I don't feel safe here. I don't feel all right. And being able to trust that in real time is very, very difficult. And just understanding that our body is picking up much more than our eyes and our ears can see in that moment. And so neuroception is a very important concept of how we walk into an environment and perceive it in these cues and how it works with our body together. And sort of bridging this into understanding a little bit more about EMDR is the concept of what fires together tends to wire together. And so if we experience the world in what I like to call a sort of social engagement, if we're looking at the infographic on the right or what's associated with that, our parasympathetic, our rest and digest nervous systems, if we're experiencing most of our life dominated within that system, we're going to perceive the world as more open, as more inviting. We can expect ourselves to be, when we say something, we expect it to be heard and validated and thought about and reflected back to us. If there's a rupture within a relationship, we can expect a level of repair with that. And so what is firing and wiring together is, hey, my environment, my relational world, the world we can generalize that to, is a pretty safe place. But if we're living in our life with experiencing a lot of threat, let's say there's a parent that they would come home and be very, very upset. And so whenever we hear the door of their car shut, or let's say that door open, we start getting agitated, we start getting upset, we start getting avoidant, we're listening to that flight response. We can start to um, associate people with levels of threat if they're starting to show those sort of signs and symptoms of sympathetic engagement, fight and flight engagement, and how that can be associatively sort of triggered within our mind in the present day. So a quick example of that would be, let's say a father coming home who's pretty upset from work and he struggles to calm himself down. So he has an open posture towards his children. And so let's say if a daughter or son gets to a certain age within the workplace, if their boss, a manager, or coworker shows similar behavior sets, they can be pulled back into that state of fear from being a child as well. And so that can be incredibly disabling and incredibly confusing for someone to experience in the present day. And it's typically it takes a little bit of investigation, typically in the therapeutic setting, to see, hey, why did this happen? What is it associated with? And how can we work through this so you're not in so much distress in the present day? And so the last piece of this as well is that shutdown aspect. If we have to experience a lot of life in that dorsal vagal nerve, that shutdown, that final layer of defense, we can really start to feel, and a lot of people have experienced a very depressed affect, struggle with major depressive episodes, really struggle to come out of that, and feeling very trapped and hopeless in that. And that's the most difficult thing to state shift from a dorsal vagal, a shutdown activation, back to a parasympathetic activation. We're able to shift relatively fluidly from our fight and flight system to our social engagement system. But that shutdown aspect, because it is so old, it is very, very demanding of our energy reserves. It takes up a lot out of us, and people struggle very greatly with that. And that reflects in depression being one of the more difficult things to treat in the therapeutic setting, that's more dominated by our dorsal vagal nerve, with something like anxiety that is much faster and much more responsive to treatment. And sort of moving on to why we're all talking about this today, it is to talk a little bit about EMDR now. And so we have a little basis of trauma, and the final thing I'll say in that is, and to sort of bridge our way to EMDR, is that a lot of traumatic events, episodes, adverse life experiences, this ends up being something that overwhelms our memory system. We cannot properly store this information. That system, that our adaptive information network and processing networks, are sort of overwhelmed by the experience. And we need to move away from that stimulus to not get into a state of terror and shock. We need to be in that dorsal vagal activation, more of a place of safety and shutdown. And so a lot of trauma ends up being a very, very difficult time in processing memories more appropriately, and being able to repair that rupture that happened there, to be able to integrate that into our overall system. And so what is EMDR? With that being said, EMDR, again, is eye movement desensitization and reprocessing therapy. It's an evidence-based way to use bilateral stimulation, like we said before, eye movements, tappings, and tones in congruence with an image, emotion, and negative cognition. So we're talking about memory now and what we associate with it, with the distressing feeling or memory, to create rapid therapeutic effects. And so that was a big mouthful that I went off on a little bit of a tangent with as well. And so just talking a little bit more about the background of this was a real chance discovery by a great in the field, Francine Shapiro. She actually discovered this by walking through a park, and through scanning her eyes back and forth, she was really able to notice that the distressing things that she was thinking about at the beginning of that walk were pretty resolved. And so from there, with her being in a PhD psychology program, she was able to create a lot of studies around this and really build this form of therapy from a very controversial place to where it was laughed at the beginning to something that is very widely used, is very powerful, and is really helping people to break through very difficult levels of trauma. So there are multiple forms of bilateral stimulation, and our understanding of it is that we know it works. There's an incredible amount of evidence of that it works in congruence with developing an appropriate target that includes a distressing image, distressing emotion, and distressing negative cognition. But we don't know exactly why it works. And some of the main theories behind that are multiple. Are excuse me. There are two main theories that I'm just going to cover a little bit this evening. One is REM sleep. We have rapid eye movements when we sleep. And so one of the theories is that hooking into this movement and dreams are typically thought of as helping our body encode memories from short term to long term, and also helping us to process and to understand and integrate things that happen through the day. And so they have speculation on REM sleep being something that is affected by this process, and sort of hooking into that same process. Along the same lines as the bilateral stimulation, the tapping, the eye movements, the other forms of tappings or tones, in congruence with the image, negative cognition, or the negative emotion. All these things in combination, if we hold them all together in these sets, we're able to really overload our working memory system, and we're able to sort of break loose the bedrock of this old association of memory and sort of clear it out and allow a new growth for more positive and more relevant cognitions, emotions, and imagery. And so we can think of EMDR as sort of advanced targeting of traumas, distressful situations, anxiety, depression. This is advanced targeting that's sort of using a system within our body to be able to sort of fast track ourselves right into that root, right into what is extremely distressing. It allows us to clear it out and sort of flush it away, and allows new growth to really take place there. And so that's a general overview of what EMDR is. It's an advanced processing therapy that is very, very powerful, and it's very, very rapid. And so what I want to move into next is to help people understand, okay, like this works fast. It's something that works, has a ton of evidence behind it. But fast is not easy, and I think, the general understanding of trauma and EMDR are important for you all to take away and to be able to talk about, to be able to listen to again. But we really need to understand from the patient perspective is fast is not easy. Okay. And so what can we expect with that? All right. And so again, I need to be very, very frank here about this is something that is distressful. This is something that is difficult, but this is something that could be utilized in a very effective therapeutic alliance, and in someone who has effective grounding strategies, and someone whose life stress isn't so distressful to the point where the stress of therapy and EMDR are going to overwhelm them. So I don't want to scare anybody today, but I want to be very honest about significance of this stress and what you're getting into, because it is serious. It is not something that's light. It can be very strong. And so we take sort of beginning measures and knowing what to expect and helping you to sort of build these resources. Okay. And so building resources is building sort of guided imagery techniques with building a safe space, building an ally within ourselves, using guided imagery techniques to really be able to start evoking specific emotions that we can evoke again on our own if we're not feeling okay, if we're not feeling safe within our body, if we're feeling overwhelmed with the stress. And we combine those imagery techniques with bilateral stimulation to strengthen them even further. Okay. And so that first part is really building resources. The second is sort of identifying these complexes. And so I sort of talked a little bit about complexes before. And so what I want people to understand and maybe visualize is that a complex is something that occurs over time, and it is contingent on the frequency of the event and the intensity of the event. Okay. And so if we have a lot of um, frequent exposures to something, let's say that an example I like to use to help people understand quickly is that, let's say you're my patient, and we're going through 10 sessions with each other. And so every single session for the first five, um, you walk in my office and I throw a paper ball at your head. And it doesn't hurt, it's not very intense, but it's frequent. It's every single time. And so your body and mind is going to naturally start associating, hey, when I walk into that office, there's going to be a paper ball thrown at my head. And so we might have some light, like expectations or sort of very light and probably playful anxiety with that. But that's just an example of, hey, when I'm in this setting now, I might associate it with getting whacked in the head by a paper ball. This can go the other way as well. Maybe we have a family member that every single time we see them, we get a big warm hug. They're very, very connective. They're very, very warm. They give us a ton of love. And so maybe even when we're thinking about going to see them, or when we start driving there, our body can start feeling that warmth. They can start associating, like, hey, I'm going to see this person. And there's been a lot of frequency and intensity with their sort of contact, their loving contact. And our body starts to activate that in anticipation. And so we can think of complexes as sort of positive and negative. It's how our emotional hardwiring has sort of learned to help us associate, hey, what happens in this environment? What happens with this person? What do I expect right now? And this is all happening very, very quickly and under our conscious intention as well. And so we sort of identify positive and negative complexes. Obviously, EMDR is more focused on the negative complexes. And that can really branch out, and we can find different targets and sort of ways in to these complexes. And so general therapy works in this way as well. I'm sort of looking to see what affects you where, so I can start to sort of feel the tone, the shape, how far back the complex goes, how deeply rooted it might be within you, and what might need to be the measures to help you sort of process or root this thing out so we can have something more useful within us as well. Because I can give you a very common example of a negative complex is that someone who is, let's say, they're a very, very good worker, but the place where they struggle the most is maybe in job interviews and going for the job they really want. And so and this might be primed from, perhaps they went for something big when they were a child, and they were punished or criticized by a parent. And so every time they start to walk into a job interview, they feel like they're going to be judged and criticized. They've been able to do okay and enough and to get by on their hard work, but when the moment comes and we really need to be able to articulate ourselves under pressure, the person might really associate that with being criticized, judged, shamed. Maybe they had a negative experience or a humiliating or shameful experience in a previous job interview. And so that when they walk in there, no matter how hard they try, their body starts to really ramp up very, very deeply into that sympathetic nervous system. And that can end up keeping them from getting past something like that, to continue to grow and develop and individuate within their life. And it could keep them sort of trapped behind this sort of door that they just can't get behind. And so that's sort of the nature of complexes in a nutshell. And sort of what we do in a very structured manner in EMDR therapy is we find the targets to this. And so when we find the targets, when we find what's appropriate, when everything has been identified in a structured manner, we start to go through the sets of EMDR and we sort of start to get on this train. And so getting on the train is a good way to understand we're sort of going down the tracks of this complex. If we could sort of see my hand here, we're going down the tracks, and as we see, there might be multiple branches from this root of this complex. There might be multiple ways in which it sort of it's manifested or presented itself within our life. And so we might need multiple passes through that original target or image to be able to fully process out from the root, or to find the root of that complex or that trauma that was imprinted within us. And so as we're able to continue to move through that, we're able to now fully clear that out and to allow more positive growth to take place in terms of, hey, I struggled with, we're able to, sort of reinterpret these on the felt level and not just the known level. We're able to really feel that, my parent, when I went for that thing, was overly critical, and that was silly of them. And I don't feel so hamstrung by it anymore. And the from interpreting a humiliating interview experience from "this is my fault, I can't," we can shift to something more adaptive, to something like, hey, that was inappropriate for them to snap on me like that. I was having a hard time, and that wasn't my fault. Like, what I did was not my fault to engender that type of response or reaction. And so we're really able to flush this negative complex out and let something more adaptive start to take root within us. And so these treatment effects can be very, very rapid. They're very, very powerful, and it's very, very structured as well, for patients. And so my form of therapy, I like to be very associative. I'm more free flowing. Of course, I'm in there and I'm directing the process. I'm guiding the process, but in something like EMDR therapy, that has to be very, very structured and very disciplined. I have to pull the clipboard out. I have to write things down. I have to sort of break out of my comfort zone to be able to make sure that we're adhering to the structure properly, that I'm guiding this patient through in an appropriate manner. And so we need to understand, again, the biggest thing that we can understand from this is some of the basics of trauma, of EMDR, or hopefully I'm communicating the basics right now. But one of the biggest things is that this fast treatment progression is not easy. Nothing comes for free. Fast changes come at a cost, and that cost is a lot of emotional stress. And so what I want us to move into, and we'll start winding down the presentation with, is working with the stress of EMDR. We need to understand the importance of pacing here. We need to understand that, hey, I'm probably not going to be able to tolerate 12 sessions in a row of EMDR therapy. I mean, if we're going to get massages every day, if we're going to, like this fella looks like he's in a cold tub right here, probably. If we're doing a lot of active recovery and living a life where we don't have to work whatsoever, or we don't have any worries, I mean, this is no one on the planet. Maybe we'll be able to do that in 12 sessions and really hit this hard. 24 sessions, we don't know how long it's going to take once we start. So we need to understand the importance of pacing and the importance of being able to communicate. Hey, I know we planned on going in to doing some of these sets this week, to moving through the process, but I'm just too stressed, or I need to talk about this other thing. We need to feel safe enough with our therapist. And we also need to respect the process. The process takes its own time. I can't tell you how many times I've had patients come in and, they want to be done in 6 weeks. And, what I'll usually tell people is that I can get you a very increased level of understanding with yourself, what you're coming in with. Maybe we can start moving through some things. But a lot of people don't even fully understand what they're coming in with in the first place. They think that the issue right now is that, okay, I'm anxious at work, or I'm too overwhelmed with work. But then we quickly find out that, oh, well, I struggle with perfectionistic anxiety, or I struggle with anxiety more in a relational place. And then in starting to process that, we start to find more and more of those roots of these complexes, and how they've been sort of engaged with us and been living with us our entire life, and through our entire life cycle. And so we need to respect the process of, we can really want things to work. We can really want things to move quickly, but oftentimes what I see time after time again is that patients simply don't understand fully what they're coming in with. But what they do understand is that they want to make a change, and they're in a lot of distress that they need help with. But we don't fully understand the nature and the severity of a lot of what we're walking in with. And then also working with the stress of EMDR. We're working with continued processing in between sessions. Dreams are very common. Some emotional dysregulation is common. Maybe some negative thoughts or different kinds of thoughts, or feeling maybe a little bit disoriented or off. These are all things to be expected because our sort of memory processing, the reprocessing that's taking place from doing EMDR, it's still going. It's still working in between sessions. We're still a little bit opened up. And that's where our grounding skills really come in to protect us. We want to develop those grounding skills so that they can become like an armor or a shield for us, so they can start working for us and to sort of protect us in our daily life. And we can identify, hey, I'm really struggling right now. Maybe before I walk in to see my family, I might need to do my safe space grounding. I might need to be able to call a friend, or really be able to sit in a meditation, so I make sure I'm okay before I enter into this next situation. And so we need to understand that EMDR is a significant stress, and that there will be continued processing in between sessions. But if everything is set up correctly, we will be able to bear this stress, to move through it, and to be able to move through the distress of coming into therapy in a rapid succession. Okay, and so I just want to talk a little bit as we start to wind down of the benefits of psychotherapy and EMDR. The general benefits of psychotherapy include really going through your own journey, your own process, and the value of identifying what is wrong to be able to move towards acceptance of that, but to also be able to move through it to sort of going from a disintegrative response where we feel all over the place and all spread out to a more consolidated sense of self, where we feel more in unison with our values. We feel like we can move through stresses with reliability, and we just feel a lot stronger as a person overall. And with EMDR, I'm really trying to integrate in a powerful tool to the overall approach for the patient's enhanced success. And so this is a very, very powerful toy we have here. We need to give it a lot of respect, but embedded within a very safe relationship with the therapist, embedded in with powerful grounding tools that we attend to, that we keep moving through, and embedded in a portion of someone's life where they're able to bear this extra stress, and not only therapy, but an advanced therapy in this way, that this is something that would be very enhancing to our overall therapeutic progress. And so I sort of dipped into the third one there, but we're able to do powerful resourcing. We're able to ground within our bodies in a very pronounced way, in addition to mindful breathing techniques. And we're also able to reprocess these very tricky, very tenaciously, the very tenacious hold of these traumas, negative complexes, and adverse life experiences. Okay. And so just a lot of general benefits of psychotherapy here. Really having an experienced guide, learning from that sense of self through this process. These are very tried and true benefits of the therapeutic process. And it's something I'm very, very serious about providing for the patient. I'm here to be a helpful guide. I sort of describe myself as I'm dropping into your world, and that's someplace I need to be invited. I need to be welcomed. Everything someone says to me is theirs to share, not mine to take. And as we push in, I can learn more about them and help encourage them in certain areas. But at the end of the day, this person is really learning from within and guiding this process. I'm just here to shape and cultivate, sort of to help them in this sort of image, to untangle the yarn here, and to make it more organized for the person to understand. And so, in conclusion, EMDR is really hard because it is very, very tough to go through. And I have a very frank belief in that we can and we should improve our emotional well-being, because the more functional our system is, going back to that sort of plumbing image, the more we can move through in terms of stress, the more effectively we can understand ourselves and our environment, how other people affect us, how we affect other people, and taking responsibility in that space, the more, the stronger we can become, and the more we can help others when they're struggling. And so I'm very, very driven behind that principle. And being frank about our emotional health is something that's extremely important. It's more okay now to address mental health symptoms than ever before. We have a greater and more comprehensive understanding of mental health symptoms, that their impact on the body, and how that is detrimental to our life cycle. Just because we can survive doesn't mean that that is a good life to live. You know, we want to be able to get human beings into that parasympathetic state so they can thrive, so they can really open up and really experience the full capacities of what it means to not only be a human being, but to discover their own individual self in that. And so, you know, we're talking every week here on Your Health Matters. I was just on yesterday. Dr. Shane Stedman is on there. Dr. Perry Maynard. Dr. Trinka is also on there. He did the last webinar, and I'm not sure how to change the announcer name, so that's why I'm labeled as Dr. Trinka still. But that's every Monday at 12:30 to 1 p.m. on KLZ The Source, with the fantastic Scott Watley. We're on there and we talk about different topics. Sometimes we do a united topic on the month, but a lot of times we'll sort of do a different topic that's interesting to us, or patients are asking about at that time. And with all the concerns with COVID and everything, especially with the recent upticks that have been happening, telehealth is available here. And so we're able to do telehealth consultations. You're able to meet with me in office. There are screening procedures in place that are there to ensure everyone's safety, but we want to let everyone know that telehealth is very available here. And so, thank you very much for joining me this evening. If you all want to get scheduled for a free consultation, or schedule someone else that you know might feel like it's useful for, you can call in on the number provided here. But you can also click the link in the chat, in the attendee chat, to set a appointment on Calendly, and that's a free 30-minute consultation. Even if you're just curious, even if a friend's just curious, I'm more than happy to just talk with someone, if they need it now, if they need it later, if they just want to be able to educate a friend a little bit that's in need, or a family member. I love being able to talk about this process and sort of give some help with no expectations there. So go ahead and click on that link if you'd like, or just go ahead and copy that number down to be able to call. And I hope this was useful for tonight, and that you have a more clear understanding of what some basics on trauma, some EMDR. And as I was talking about, I was realizing, like, wow, this is a lot of information right now. It can be very difficult to understand. So once this recording is posted, I encourage you to be able to listen to it again, or to, just watch some YouTube videos on it. Or if you want more of an understanding, you can ask me questions as well through a consultation, or if you're just coming through the office and have some questions. And so, again, my name is Jacob Meyer, and I'm the psychotherapist at Integrated Health Systems. Thank you all very much for joining me this evening. Went up going about 15 minutes over here, but you all have a great evening, and I look forward to any questions, comments, or concerns, or any consultations that you would like to take place. And so you all have a great rest of your night, and thank you again for joining me.